I don't know why. Okay. All righty. Thank you so very much, Neil. And it's so good to be with you today on our WCKB Let's Talk program. And we are just excited about the program today, as again, our special guest will be Dr. Raj from Champion Heart and Vascular Center in Dunn, located 710 Irwin Road in Dunn. And for all you folks who have had the opportunity to tune in to this series of programs, I know that you have received a lot of very valuable information, helpful information. A lot of questions have been answered over the last several weeks. And Dr. Raj, we again welcome you to WCKB, and we appreciate you coming out today to be with us on the program.
Thank you so much.
Well, we've had over the last several weeks, I've been on the program a time or two, and Cherie is usually here hosting the program. And there's been a variety of subjects that have been covered concerning the what you do there at Champion Heart and Vascular Center in Dunn. And we're so glad that y'all are now a part of the community and this surrounding area. But today we have a very interesting subject that we're going to be talking about, something that we all hear about, and something that folks have, many folks listening, I'm sure, have had done, and that is exercise stress testing and nuclear stress testing, which of course usually, I guess, pertains to the heart and possible problems. Tell us a little bit about that concerning these two tests. They're for the same purpose, I guess, but they're a bit different, right?
Yes. So we have many ways to stress the heart to find if a patient has a blockage in the heart or not. And one is called the exercise stress test, where you just do a stress test under a treadmill, and you hook up all the EKG leads on the chest and see how the heart is pumping, and look at the monitor and see if the patient has a blockage or not. That is an exercise EKG stress test. And there are other kinds of stress tests are also there, like an echo stress test and a nuclear stress test. So these are other ways to do the stress test.
Concerning these tests, we hear, seems as though we hear usually that if someone's having such a test done, it's usually the treadmill. But sometimes when the nuclear test is done, there's something maybe that arises that makes the doctor say, well, let's do the nuclear test. That happened actually in my case many years ago. My blood pressure was up when I got to the doctor's office, and instead of walking the treadmill, they did the nuclear stress test. Is that usually is what happens? Maybe the blood pressure is up or something like that?
So if you think about why we do a stress test, so that starts our reasoning behind what kind of stress test to do. A stress test is to find out if a patient has a blockage in the heart arteries. You know, some people think, hey, heart itself is pumping blood. How can it have reduced blood flow to it? Because heart is like a receptacle where it holds the blood and pumps it. And the pump itself has tubes or arteries which supply the muscles. And when you exercise or when you walk, the muscle contracts and it needs oxygen to the muscles. And when there is a reduced blood flow to the muscles, then you have angina, which is the chest pain. The other one is called a shortness of breath, where you have a difficulty in breathing because of less oxygen to the heart and it's not pumping enough blood to the lungs.
Mm-hmm.
So we are trying to figure out if a patient has reduced blood flow to the heart muscles. And so there are different levels of stress. The first thing, a patient has reduced perfusion, that is reduced blood flow to the capillaries inside the heart muscles. The next thing is the heart starts to pump slow, doesn't pump vigorously. The last one will be the muscles are not moving. So if you take, and the fourth thing is you will see the changes in your EKG. So when you wanted to find a very low blockages, you do a nuclear stress test, because nuclear stress test does the perfusion of the heart.
Uh-huh.
And when you want to see if the muscles are weak or do they not move properly, you do an echo stress test. And the last part is the changes in the EKG. That's the fourth level. So you have to have 3 different levels of ischemia or decreased blood flow before even you can see a change in the EKG. So a doctor or a cardiologist like me will decide if I think the patient has a higher level of blockage, then I will go for just an EKG stress test, because I just want to know, I already know the patient has a blockage. Now, when they exercise, do they have changes in the EKG, which means their blockages needs to be fixed.
Mm-hmm.
And let's say someone who is healthy and you think they have a very low likelihood of a blockage, then I will do a nuclear stress test,
Mm-hmm.
which will find a blockage even at a low level of blockage.
Mm-hmm. Okay, that's very interesting. So there's actually a difference there in these 2 tests, and each of them have their own purposes of discovery. So that's very interesting. Is there any reason for an individual, a patient, to fear having such a test done? Sometimes we put a test off because of fear of the unknown, for example. But these tests take place every day.
Yes, this is one of the tests which has been tested and has been going on for more than 100 years now. Mm-hmm. In various levels, and it's a very low risk test. As with any stress test or any cardiac test, there is a small risk. Mm-hmm. in a test. We say that 1 in 10,000 patients can have an abnormal heart rhythm. That's a reason a cardiologist is present during a stress test in case a patient goes into an abnormal heart rhythm and we need to revive them back. But the reason to do the stress test is to figure out if a patient has a blockage. So when they have a blockage, they can have an abnormal heart rhythm. And that's what we are looking for, to see if a patient needs a stenting or more medications to decrease the blockage.
Mm-hmm. So depending on how the test turns out, you may, after the test and after the results are in, sometimes I guess you suggest a catheterization be done?
Yes. So if a patient has a stress test, we can have a results like a mild, moderate, or severe disease. Mm-hmm. It depends on which category are you going to be there. Mm-hmm. So for the mild disease, we usually treat them medically with a medical therapy like aspirin, cholesterol medicine, and anginal medicine, which is a chest pain medicine like beta blockers, calcium channel blockers. These are the group of medicine we give them to reduce the chest pain. Mm-hmm. And if a patient has a moderate or a severe disease, then we would recommend catheterization. Mm-hmm. Or even after treating with the medications, patient undergoes or continues to have chest pains with exertion, then I would recommend having a catheterization to see how the blockage is there.
Mm-hmm. say in a person's medical history, sometime in the past, they were diagnosed with an irregular heartbeat or something like that. Is that something to be concerned of, or something that might point to eventually having a stress test?
The answer is yes and no. So it depends on what kind of abnormality do they have.
Mm-hmm.
So we have a condition called atrial fibrillation, which is an irregular heartbeat. And there's other kind of irregular heartbeat called ventricular tachycardia or ventricular fibrillation. These abnormal heartbeats can cause a patient to faint or die.
Mm-hmm.
And if a patient has an abnormal heartbeat coming as a ventricular fibrillation, ventricular tachycardia, which are the severe ones, then yes, we would recommend them to have a stress test to see if there is a blockage
mm-hmm.
causing these abnormal heartbeats.
For the folks listening out there who maybe have some symptoms, it could be shortness of breath. I've heard people comment to me before saying things like, I can hardly walk 10 or 15 feet and I'm out of breath. Haven't been to the doctor in a while, haven't had a checkup in a while. For symptoms that we might notice on our own around the house, it could actually point to a need to see the doctor and maybe talk with you about an EKG or getting a stress test done. Is that correct?
Yes. If a patient has symptoms and we need to identify what is the symptoms are coming from. If it's a shortness of breath, it could be lungs or heart.
Mm-hmm.
And initially, if the patient has multiple risk factors like hypertension, if they are overweight or obese, diabetes,
yes,
and a man who is older than 45 and a woman more than 55 years of age, if they have a family history of heart disease, stroke,
mm-hmm.
or if anyone in the family has lost their legs because of peripheral vascular disease, and also if a patient has like an autoimmune disease like rheumatoid arthritis, lupus, these all increase the risk of coronary artery disease. And these patients need to see a cardiologist to check what their symptoms are coming from. And once they are, if let's say someone who was doing like a mile a day and suddenly they're not able to do even a half a mile without shortness of breath or chest tightness, they should be recommended to have a stress test done.
Mm-hmm. Okay. Now, I was wondering, a lot of times when I've been to a doctor's office, for example, and years ago, over the years, I've had stress tests done too. And a lot of times it's the older folks, maybe like you say, over 45, but it could actually be a situation where a young person maybe is in need of getting their heart checked out and making sure there's no problems, especially if they suspect there is a problem or have a family history of such problems. Is that right?
You're correct. If the patients have a family history of coronary artery disease, which is actually the blockage in the heart arteries, if a male in the family have a heart attack or
mm-hmm.
any angina or a bypass surgery, usually I would recommend someone to start checking 10 years earlier than what their male counterpart, like a sibling or a family, like an uncle or a parent who had it, at least 10 years before a male or 20 years before a female had the
mm-hmm.
heart attack or heart disease.
Our guest today on our WCKB Let's Talk program is Dr. Raj of Champion Heart and Vascular Center, 710 Irwin Road in Dunn. And today we're talking about exercise stress testing and nuclear stress testing. And for more information, contact the office at 910-304-1212. That's 910-304-1212. You can get more information about getting an appointment set up. And Dr. Raj, now these tests, are they done right there in your facility?
And yeah, all these tests are done in my facility, and they are very simple tests. And so if I can tell you that these tests needs an IV, and usually the patients come fasting. They do not have any coffee or tea or Coca-Cola,
No caffeine.
no caffeine, even decaf for at least 24 hours before the test, because these tests can be skewed if they take one of these, coffee, caffeinated drinks. And second thing is, we also let them say stop medicines which will decrease the chest pains, like beta blockers, like anything which starts with oil, metoprolol, atenolol, carvedilol, labetalol, anything which starts with oil, they have to stop at least one day before the test. Same thing with the calcium channel blockers like diltiazem and amlodipine. Those things have to be stopped. And these tests are much simpler, so I can do that in my own office. And they'll be expecting at least to spend 2 to 4 hours in the office. When they come in, we get an IV for them, because through the IV, we give the nuclear medicine. So the nuclear material is injected through the IV, and this medicine goes and gets located in the heart muscles. So we take 2 pictures, one picture at rest when we inject it. And if the patient has a previous heart attack, the nuclear material does not go to the infarcted or scar or the previous heart attack area. It does not light up. Other areas light up. So we know if a patient had a previous heart attack or not. That's how we could find out. Once we do the rest pictures, the next picture we take is a stress picture. So stress can be done as a regular treadmill that we do for an EKG. So we make them walk on a treadmill, or give medicines to increase the heart rate, or to dilate the arteries in the heart. That's how we stress the heart. Once we stress the heart, then we do a second image of the heart and compare the first one at rest and second one at rest, at stress, and see if there is a decrease in lighting up of the medication in the heart. So that's how we can say there is a blockage, because when there is a blockage, the blood does not reach the muscles. So if the blood doesn't reach the muscles, the nuclear material doesn't reach the muscles. So by comparing a rest image with the stress image, we could say there's a blockage or not a blockage.
So these tests are so important, and we're so blessed that these tests are available, because they can certainly prevent a heart attack. Maybe somebody is going down the road toward a heart attack, and but by these examinations, preliminary examinations, that maybe leads to one of these stress tests, it could very well say, and you probably know of instances when lives were saved.
I would say yes and no. The main thing is prevention is better than cure.
Exactly, yes.
So when someone has symptoms and they have an abnormal stress test, they already have gotten a blockage. And will all the blockages cause heart attack? The answer is yes and no. Because most of the heart attacks are caused by blockages less than 50%. And because these blockages, which are very, very small, actually are like a hotbed, like a volcano ready to rupture. When they are growing from 0 to 50%, they are in the growth phase, and they can always, rupture, and they can form a clot, and they can block the whole vessel. When we do a stress test, we are only be able to find the blockages of more than 70%. And these blockages do cause heart attack, but not all the time,
Mhm.
because they're already mature blockages, and these cause symptoms.
Mhm.
So that's the reason I'm telling that prevention is better than cure. When we find something in the stress test, it does find blockages, but does not always prevent heart attack, because there are many instances we do not find the stresses to be abnormal in a patient who has a blockage less than 70. We may be missing these blockages, and the only way is to talk to the cardiologist, and maybe do other tests to find if there's a blockage. Earlier blockages, these stresses will show blockages which are in late stages.
It seems as though down through the years, the last, I don't know, 15, 20 years, there's been so much progress in tests that have come along to um, geared toward the heart and protecting our hearts and checking our hearts out and things like that to avoid heart attacks. And we especially seem to hear so much about stents being put in, and instead of open heart surgery, for example. Is that sort of the case around the country now?
Nowadays, we have started having more advanced techniques, and the engineering has become more advanced, and the stents have become much lighter, and it can be delivered to all the parts of the heart without a need for bypass surgery. And it's very rare I have sent a patient to bypass surgery. Almost every patient can be fixed without a bypass surgery. And we have techniques called Atherectomy, which is same like a plumbing system where we use a roto-rooter to clean it up. We actually use those kind of devices where we can clean the artery before putting a stent in. So, and we also have lots of support system to put stents and prevent from having a bypass surgery.
Our guest today on our WCKB Let's Talk program is Dr. Raj from Champion Heart and Vascular Center, located here in Dunn, 710 Irwin Road. Again, their number there at the office, if you'd like to get an appointment scheduled, is 910-304-1212, 304-1212. And I understand y'all really make it pretty simple for folks who come in. They're in many cases, they find that they can get their checkups or their treatments done right there without going to the hospital. It can be more of a comfortable atmosphere for them, Dr. Raj.
Yes, there have been a lot of studies which have shown that patients would like to see the same doctors who is seeing and treating, and we provide the same environment in our facility where it's like a one-stop shopping. You could get every testing for the heart, and it could also be fixed in the office, most of the ailments for the heart. So and the tests are much cheaper when compared to the hospital. At least few tests are at least 10 to 20 times cheaper than a hospital bill.
The location is very convenient too for this area, 710 Irwin Road in Dunn. And there's just a great location, a central location for this area. I want to talk a little bit about your training. It's just so prestigious. I mean, you completed a cardiology fellowship at Cedars-Sinai Medical Center, UCLA in Los Angeles, and your interventional cardiology fellowship at Yale, and I could go on, Harvard Medical School. You've really got a fantastic background, and you must have become interested in this career very early, I would suspect.
When I was, most people say, what would you like to do if you were to go back in your life? And I still think, even if I go back in my life, I really wanted to become a cardiologist again, because I love my job and I love my patients. So I don't know what else I can do in my life other than cardiology.
You help people in such important ways. And also there is Dr. Shishadri. He's there as well on staff there. And we want the folks to be sure to listen to this series of programs every other Tuesday here on WCKB with Dr. Shishadri or our guest today, Dr. Raj, who has come out to be with us on the program today. And what about insurance programs? Folks can use their insurance there at your office too, I'm sure.
Yes, I accept most of the insurances. Almost every insurance are accepted in my office. I also see patients with no insurance and have a sliding scale for people who cannot pay, and have a program where they can pay weekly or monthly. So no patients are denied to be seen in my office. Anyone with insurance or no insurance can be seen.
And again, in just a few moments, we'll be giving that phone number again. So you folks be sure to write that number down. And as you're traveling on the Dunn-Irwin Road, keep an eye open for Champion Heart and Vascular Center, 710 Irwin Road, right here in Dunn. And be sure to tune in every other Tuesday for this very special program. By the way, talking about the next time that y'all are on with us, which will be on June 8th, it'll be echocardiography or ultrasound of the heart. Did I get that right?
You got it right.
Okay. Well, that sounds very interesting. So we're looking forward to that. It's just a couple of weeks off. Our subject today with Dr. Raj, of course, exercise stress testing and nuclear stress testing. And we have a couple of minutes or so to go here today, Dr. Raj. Any final thoughts or special points you'd like to bring out about this subject today?
Now it's a time where COVID has been rampant everywhere. My recommendation for folks out there is this is the time that you are at home, not exercising, because you don't go out, you don't go to the gym. It's very important you take care of your health and try to exercise, eat healthy, try to be eating plant-based diet rather than eating more meat. And also, keep your mind calm, do meditation or yoga. If you have any shortness of breath or chest pain, do not wait until the last minute to see a cardiologist. Always, prevention is better than cure. Once you have a disease, we are going to be trying to stop its complication, and we cannot undo things which has happened. Once there's a damage to the heart muscles, it can't be undone most of the times.
Our guest today, Dr. Raj from Champion Heart and Vascular Center right here in Dunn. And we do encourage you to find out more about them. Tune in to this series of programs. Again, we'll be back on in just a couple of weeks. And by all means, give them a call there if you have any questions. They'll be glad to answer your questions. And if you'd like to get an appointment set up, be sure to do that as well. 910-304-1212. 910-304-1212, and they're conveniently located 710 Irwin Road right here in Dunn. That's the old Dunn-Irwin Road as we know it, and a wonderful location to serve the area. I mentioned earlier, I was talking about the training that Dr. Raj has had through the years at prestigious institutions like Yale University and Harvard Medical School, UCLA, Cedars-Sinai. I didn't mention Duke University there as well. So we're just so glad that you and Dr. Shishadri are a part of the community, that Champion Heart and Vascular Center is here to serve the people. And we appreciate you coming out and being with us today, Dr. Raj, and look forward to having you back on real soon.
Thank you so much. Thank you.
Thank you. Dr. Raj of Champion Heart and Vascular Center, 710 Irwin Road in Dunn. Again, their phone number for more information or an appointment is 910-304-1212, 304-1212. For our WCKB Let's Talk program, This is Ron Tart thanking you for listening, and we'll see you again soon.
Thank you.